Hi, my name is Dr. Milena Marshalek. I'm the Clinical Lead and Academic GP, and member of the team at the Clinical Effectiveness Group at Queen Mary University of London for the Quality Improvement Programme aimed at improving timeliness and equity in delivering childhood immunisations, one of the London Pathfinder projects. I'm going to tell you a bit about our work so far, and here's a bit of a background about the problem that we're aiming to tackle. London has the lowest immunisation rates in England, and research done in our departments demonstrates that this has worsened during the pandemic. There are marked inequalities in vaccination. Children are less likely to be vaccinated if they live in certain boroughs, are more deprived, or identify as black or of mixed ethnicity. Therefore, we have created an intervention aimed at tackling these inequalities. The aim of our intervention is to increase the percentage of children completing their primary immunisations by age 8 months, to increase the percentage of children receiving their first MMR by 18 months, and reducing inequalities in timeliness by NHS area, deprivation and ethnicity. We plan to do this using the Apple IMS tool, a toolkit for GP practice teams to navigate the complex routine vaccination schedule. It demonstrates information for all children at the practice, enabling teams to prioritise appointments according to when immunisations are due or overdue. It is delivered alongside online and in-person visits by facilitators to help practices download the tool and use it effectively, and with online resources such as demonstration videos and a written user guide. This is the clinical effectiveness approach, which uses data, incentives and facilitation to support behaviour change. Along the way, we have monitored our process measures, produced preliminary results, and engaged with patients about why inequalities in vaccinations may persist and what we can do about them. Our initial process measures demonstrate that 87% of practices across North East London have downloaded the tool. 42% of practices across North East London have received a visit from a CEG facilitator to use the tool. Our preliminary results demonstrate that the percentage of children receiving their first MMR by 18 months increased by 3.1% between September 2021 and September 2022 for practices that use both the tool and facilitation visits. A full evaluation is planned, with the protocol published in an academic journal. Our patients and public told us about the importance of accessible, local, easy and flexible vaccination services. We discussed using relevant communication materials and the best ways of delivering information about vaccinations to diverse ethnic communities. And finally, we discussed ways of building trust with marginalised communities. Through the delivery of the programme, we learned that data is not information. A single source of data truth requires a consistent flow of data throughout information services. That clinical software works best when combined with the clinical effectiveness approach. And we also found that the combination of clinical informatics and immunisation expertise are key to the performance of the programme, and that we should keep an actionable focus on local areas with low uptake to improve equity and to reduce the risks of measles outbreaks. Some limitations we encountered along the way included the negative impacts of NHS reorganisation on the delivery of a local incentive scheme for the programme, that data are not analysed consistently across London, and that there are difficulties in estimating the impact of the programme earlier on. And finally, the rollout of the London Polio Booster campaign impacted the delivery of planned pilots in other areas of London. However, the Apple IMS tool was adapted to support the polio campaign in North East London. So what are we doing next? We plan to initiate pilots in North West and South East London, release a new version of the tool with updates, carry out a full evaluation of the tool in 2023, to continue to disseminate the tool and its evaluation across academic publications and social media, and to ensure sustainability of the tool by introducing local financial incentives, continuing to share learning around the tool, and promoting leadership buy-in for the programme.